Hello and welcome to NCTV episode 73, which is all about bunions, or hallux valgus as they're also known in the medical world. These are something I get asked about every so often in clinic, and while there's not an awful lot that you can do about them, this will at the very least provide some information and advice on the matter, which should prove helpful if you or anyone you know suffer from them. So firstly, what is a bunion? Well, it's a protuberance of the bone combined with swelling of the base of the big toe, which creates a bump on the inside of your foot, as you can see. Typically, you'll also see the tip of the big toe squashing up against the other toes, and the bunion itself can also look a bit red and angry at times. Whilst on the topic of bunions, it should be said that there are also similar deformities which can occur on the opposite side of the foot called bunionettes, which essentially are the same thing but occurring at the base of the little toe. The exact cause of a bunion is unknown, although there are a number of theories, some of which are that they are inherited, they may be caused by foot stress or injuries, or even due to trauma at birth. Experts tend to disagree on whether tight, high-heeled or too narrow shoes cause bunions, or whether footwear simply contribute to the development of them. What can be said is that bunions are very rare in populations that don't wear shoes, so make of that what you will. It's also thought that bunions might be associated with certain types of arthritis, particularly inflammatory types such as rheumatoid arthritis. And there's an increased risk of getting bunions if you have low arches, flat feet, or loose joints and tendons. The types of people who are susceptible to bunions are those in occupations such as teaching and nursing, which involve a lot of standing and walking. Also, ballet dancers due to repetitive stress on the toes, and pregnant women because of the hormonal changes, which loosens the ligaments and flatten the feet. However, because the exact cause of bunions is unknown, it does make it difficult for you to actually prevent them. Some preventative measures that might help though are making sure that your shoe size is correct and that you have enough room at the end of your toes to move. Likewise, avoid shoes with high heels or pointy toes. Heels tend to exacerbate the problem by tipping the body weight forwards, forcing the toes towards the end of the shoe, which may explain why bunions are 10 times more common in women than they are in men. The symptoms you tend to get with bunions are pain, rigidity and inflammation, as well as calluses and corns on the bump itself. As a consequence of the reduction in function of the big toe, the demands on the second toe increase, often resulting in hammer toe or claw toe or metatarsalgia, as it fails to cope with the added pressure being put through it. Obviously, this can all combine, making it very difficult to walk at times. So this is all well and good knowing about bunions, but what can you actually do to help the situation? Well, as alluded to, wearing comfortable shoes that fit well and allow your toes to spread at the end is a good start. If you're flat-footed, you can use an arch support to help. And some people have found relief using bunion pads and splints, but the jury's still out on the latter. Short-term treatments may involve hot or cold therapy, anti-inflammatories, massage, ultrasound, and cortisone injections, but beware of the side effects. As long as the bunion's not impacting your daily life too much, it's the sort of thing that you may actually just have to live with. If, however, you've tried all the conservative measures, the next port of call might be to book yourself in to see the doctor or podiatrist. If you've tried all this and still to no avail, and you're experiencing extreme pain, then surgery is an option, and it's considered to be the only real way of getting rid of a bunion, although it's worth noting that bunions do sometimes come back after surgery. In saying that, a properly performed operation has a high success rate, and while the recovery period may slow you down a little, you'll be back on your feet within a few days with crutches, and often a full recovery can be made by about 3 or 4 months after the operation. That's it for this week's bite-sized bit to help your health flourish, and I'll see you again next time. Bye for now.